Well, I'm here with CASIE Feathers, and she's our Director of Therapy Services. And tell me a little bit about what you do.
So I oversee the operations of all of our services, including our acute care services, our home health services, our outpatient services, our skilled nursing services, and inpatient rehab. From the hospital system, we have about 65 staff, therapy staff members. So combination of PTs, OTs, speech therapists, and our techs.
When it comes to therapists, how can we identify them in the hospital?
We all wear red scrubs, so we wear departmental colors, which helps the patient to identify who's coming into the room and working with them on a daily basis.
What do you love about your job?
I love being able to affect somebody's life, being able to take them from a period of time where they might not be performing as well as they'd like to, and seeing that patient regain independence in the community, and then one step further, seeing them out in the community is extremely rewarding.
Tell me a little bit about what sets Shannon apart in terms of therapies.
I think what sets us apart is really the dedication that we provide to our staff, the support that we will give them to increase their knowledge so that we can provide better care and more specialized care to the patients that we see.
We've added a new service, and it was something that you started. Tell us a little bit about that new service and why you thought it was so important for us to provide that.
Approximately 2.5 years ago, we opened up a outpatient neurotherapy department, and so we were, had a little bit of a less access in San Angelo, so we really wanted to specialize in being able to give that type of care to our patients after they left the hospital system. So that service line has been doing quite well. We see quite a few patients on a monthly basis, and it's a multidisciplinary department with PT, OT, and speech, and so many of our patients will come for 3 hours a day to therapy.
We're excited because after we leave here, we're going to actually go over there and kind of see what's going on in that area, which is actually on our St. John's campus. I'm here with Jessica, and tell me a little bit about this clinic.
So we're at the outpatient neuro facility here at Shannon. We offer PT, OT, and speech. We offer a really specific and special service here so that we can spend that extensive one-on-one time with our patients and really get to focus our time during therapy with those patients.
Just from being here, I can tell you see a lot of different ages. So what's the span of ages that you guys see?
We have seen anywhere from under 10 to over 90.
One thing I noticed with coming in here that you actually had a patient that came by here that is not a patient anymore, but came by here to see you guys. So you guys get real close with your patients, right?
We do, and sort of like that one-on-one time I was talking about earlier, we get to know our patients really well. We get to know a lot of their family really well since they have family members that come in with them. So we have actually a higher frequency than I think maybe other clinics have of patients coming back to see us and just letting us know that we're still in their thoughts and that they really appreciate all that we've done, and so it's just kind of really uplifting when they get to do that.
Well, personally, I really love seeing that because a lot of times when I'm talking to new hires, I always tell them that the way I describe our mission is that I want their family members to be treated like I want my family members, and obviously that's what you're doing here, and I just appreciate all the work you're doing. You're doing such great work, and thank you for visiting with us today.
Yeah, absolutely, yeah.
Well, I'm here with Shauna, and we're actually at our Southwest Medical Office Plaza. And tell us a little bit about what you do out here, Shauna.
So out here we do handle a lot of our orthopedic patients from the physical therapy standpoint. So everything from post-operative to people that are trying to avoid surgeries to general just wear and tear injuries. So we take care of head to toe anything orthopedic.
How many patients do you see on a daily basis?
So typically between 80 and 100 through the clinic a day.
That's impressive, and we're kind of excited about you because you're in a new space, right? And your space is almost doubled, right?
Yes. We're very blessed to have a great referral base that they really value therapy, and so we keep growing, which is a great thing. And so when we were in our original space, we had 6 therapists in a space where probably 3 to 4 can fit, and so we were getting to the point where we needed bunk beds for our patients, and so we're really excited to have our new space, and our patients can have the opportunity to do all the exercises they need, and our therapists can do everything they need to do in our new space.
a lot of your therapists have a special certification. Can you tell us a little bit about that?
Sure, so we always try to push each other to try to get a niche market and figure out what we can do to provide, specialty care for our patients. And one thing recently that 4 of our therapists have gone on and gotten is called dry needling. And so that was a service that if a patient needed that before, they would have to leave Shannon. And so we're so proud to be able to keep those people in-house and be able to help them when they need that service.
That's one of the things I love about a lot of people like Shauna that work at Shannon. We're always staying cutting edge and very innovative and bringing new things to Shannon so our patients don't have to travel. So I appreciate that.
Absolutely.
Thank you for your time.
Yeah, thank you.